Plantar fasciitis, a common yet often misunderstood condition, is a source of significant discomfort for many individuals. It primarily affects the plantar fascia, a thick band of tissue that runs across the bottom of the foot, connecting the heel bone to the toes. This structure plays a crucial role in supporting the arch of the foot and absorbing the impact of walking, running, and jumping. When this tissue becomes inflamed, it leads to the sharp, stabbing pain that characterizes plantar fasciitis, particularly noticeable with the first steps in the morning or after prolonged periods of sitting. Understanding the etiology of plantar fasciitis is essential for both patients and practitioners. The condition often arises from repetitive strain and overuse, which can be exacerbated by various factors. Individuals who are overweight or obese are at a higher risk due to the increased stress placed on the plantar fascia. Additionally, certain occupations that require prolonged standing or walking on hard surfaces can contribute to the development of this condition. Athletes, particularly runners, are also susceptible, especially if they have suddenly increased their training intensity or changed their footwear. The symptoms of plantar fasciitis can vary in intensity, but typically manifest as a sharp pain in the heel or along the arch of the foot. This pain is often most severe in the morning or after periods of inactivity, as the fascia tightens overnight. As the day progresses, the pain may diminish with movement, only to return after long periods of standing or sitting. This cyclical nature of the pain can be frustrating and debilitating, impacting daily activities and overall quality of life. Diagnosis of plantar fasciitis is primarily clinical, based on the patient's history and physical examination. A thorough assessment often reveals tenderness along the plantar fascia, particularly at the heel. While imaging studies like X-rays or MRIs can be utilized to rule out other conditions, they are not typically necessary for a straightforward diagnosis of plantar fasciitis. In some cases, heel spurs may be present, but it's important to note that these are not always indicative of plantar fasciitis, as many individuals with heel spurs do not experience any symptoms. Once diagnosed, the management of plantar fasciitis can be multifaceted, often requiring a combination of conservative treatments. Rest is paramount, allowing the inflamed tissue to heal. Ice therapy can also be beneficial, reducing inflammation and alleviating pain. Stretching exercises, particularly those targeting the calf muscles and the plantar fascia itself, are crucial in restoring flexibility and reducing tension. Strengthening exercises for the intrinsic muscles of the foot can also play a role in providing better support to the arch. Footwear is another critical component in the management of plantar fasciitis. Supportive shoes with adequate arch support and cushioning can significantly alleviate symptoms. In some cases, custom orthotics may be recommended to provide additional support and distribute pressure more evenly across the foot. It's essential to avoid walking barefoot on hard surfaces, as this can exacerbate the condition. For patients who do not respond to conservative measures, more advanced interventions may be necessary. Corticosteroid injections can provide temporary relief by reducing inflammation in the affected area. However, these should be used judiciously, as repeated injections can weaken the plantar fascia and potentially lead to rupture. In rare cases, surgical intervention may be considered, particularly for patients with chronic symptoms that do not improve with conservative treatment. Surgical options can include plantar fascia release or heel spur removal, but these procedures are typically reserved for the most severe cases. Education plays a vital role in the management of plantar fasciitis. Patients should be informed about the nature of their condition, the importance of adherence to treatment protocols, and the potential for recurrence. Lifestyle modifications, such as weight management and activity modification, can also be beneficial in preventing future episodes. Encouraging patients to listen to their bodies and avoid pushing through pain can help mitigate the risk of exacerbating their symptoms. The psychological impact of plantar fasciitis should not be overlooked. Chronic pain can lead to frustration, anxiety, and even depression, particularly if it interferes with daily activities or hobbies. Encouraging open communication about these feelings can help patients cope better with their condition. Support groups or counseling may also provide additional resources for those struggling with the emotional toll of chronic pain. In recent years, there has been growing interest in alternative therapies for plantar fasciitis. Techniques such as physical therapy, acupuncture, and shockwave therapy have shown promise in some studies, although more research is needed to establish their efficacy. Patients should be encouraged to discuss these options with their healthcare providers to determine the best course of action for their individual circumstances. As we continue to learn more about plantar fasciitis, it becomes increasingly clear that a multidisciplinary approach is often the most effective. Collaboration between healthcare providers, including primary care physicians, physical therapists, and orthopedic specialists, can lead to better outcomes for patients. By working together, we can develop comprehensive treatment plans that address not only the physical aspects of the condition, but also the emotional and psychological components. In conclusion, plantar fasciitis is a prevalent condition that can significantly impact an individual's quality of life. Understanding its causes, symptoms, and treatment options is crucial for both patients and healthcare providers. With appropriate management, most individuals can find relief from their symptoms and return to their daily activities. As we continue to advance our knowledge and treatment strategies, we can hope to improve the lives of those affected by this challenging condition. The journey to recovery may be long, but with perseverance and the right support, relief is attainable.